Hi everyone, thanks for tuning in today. My name is Meghan and I'm a sexual health clinician with the Prostate Cancer Supportive Care Program.
And my name is Christine Zarowski, and I'm also a sexual health clinician with the Prostate Cancer Supportive Care Program.
This presentation is about managing the impact of prostate cancer treatments on sexual function and intimacy. This presentation can also pertain to patients with bladder cancer. First of all, we want to applaud each and every one of you for watching this video today. We know that this can be a time of many changes and challenges, which may be emotional, physical, or psychological. We hope to share some knowledge with you today that will help empower you on your cancer experience. We want to give a quick thank you to our funders. We are a grant and donation funded program, so we are thankful for the continued support of our donors. Without the funding and support, we would not be here for you. Today we will begin by discussing our program and what services we can offer. Then we will introduce the concepts of sexuality and intimacy and what normal sexual functioning is. We will discuss the impact prostate cancer treatment can have on your sexual function and some management approaches. We will be reviewing a lot of information in this presentation, and the degree of relevancy will depend on what stage you're at in your cancer experience. Here is some more information about the PCSC program. We offer education sessions, clinical support appointments, and have a research component in our program to better understand the needs and treatment strategies for prostate cancer survivors and their partners. Here are the different education modules that we offer. They are all offered either in person or through live online programs. Most of these education sessions are offered every month and have a clinic. So if you are interested in learning more about our one-on-one appointments or our education sessions, please get in contact with the program coordinator. In the Sexual Health Clinic, our goal is to provide education, supportive care, medical and surgical therapy to enhance your sexual functioning, intimacy, and overall quality of life. Our program is located in Vancouver, but we do serve people from all around BC. Our lead physician is Dr. Ryan Flanagan in Vancouver, and on the slide you can see our administrative leads for the program.
There are different ways of accessing care. Our sexual health clinic offers one-to-one clinic appointments with a sexual health clinician for patients and their partners to discuss the impact of treatment on sexual function and intimacy. A lot of information in this presentation is very brief and generalized, so we recommend signing up for the clinic for a more personalized plan of care. The online Share eClinic, which stands for Sexual Health and Rehabilitation eClinic, has been designed for individuals who have prostate cancer. This is an online course where you can access educational modules. This is a good option if you prefer to learn on your own pace. You'll need a login code to access this program, and this can be obtained through our program. We recommend combining our sexual health clinic with the online Share eClinic, as both clinics complement each other in the efforts, education, and resources needed to help you with your sexual adaptation process. This is actually a sample of the eClinic. On the left-hand side is the patient dashboard, where you can access various resources such as a care plan, a wellness plan. You can make a schedule with to-do list, keep track of any symptoms you may be having, and you're able to include a circle of care if you have a partner. Here's an example of a patient, George, speaking with a health coach using instant messaging on the bottom right. I happen to be the health coach for BC and can help you navigate the Share Clinic platform. So you probably heard that treatment for prostate or bladder cancer can affect your erectile functioning. This can impact your sexual functioning, how you feel as a sexual person, and intimacy with your partner. Today we're going to start with creating some perspective with information about intimacy and sexual functioning. A lot of the information will seem specific to a partnered relationship, but most of it can still pertain to you if you're single and also if you're interested in finding a new partner. Let's take a closer look at sexuality, as there are many components. Sex is something that we do, and sexuality is the essence of who we are as unique individuals. It is how we express ourselves, what brings us joy and pleasure. It includes all the feelings, attitudes, and behaviors that contribute to a person's sense of self. What you see before you is the wheel of sexuality, and it shows the diversity of our sexuality, including elements of biology, psychology, and social influences. It is important to be aware of these components and how they may be impacted by your cancer experience. Having that awareness will help you as you go through the sexual adaptation process, which I'll talk more about later on in this presentation. Our values and beliefs around sexuality can be influenced by societal myths, Let's explore some myths in our society that we've all heard about. People with health challenges have no interest in sex. People still have interest in sex despite having health challenges. Male orgasms require an erection. This is a very common myth. Even with a soft penis, you can still achieve orgasms. Sex is for young people. Definitely not true. Many people are sexually active until the end of their life. At the end of one of my education sessions, I had a gentleman come up to me and he says, Chris, I really, really enjoy being sexual with myself, sexual with my partner. I really grasp the essence of my sexuality, but I know I shouldn't be sexual anymore because I'm 83. Fortunately, we were able to debunk that myth for him. Sex requires orgasm. You can still have good sex without orgasm, as it still can be enjoyable and pleasurable. And of course, sex education is only for disease prevention. We commonly think sex ed is just for information about sexually transmitted diseases, yet sex ed is for many reasons, including understanding sexual dysfunction or even learning new ways of being sexual. Sex should be spontaneous with no planning and no talking. Sometimes sex does need to be planned, especially when using some of the devices, which we'll talk more about later. Sex means sexual intercourse. There are many ways to define sex. It can mean oral sex, touching, self-stimulation, etc. Many different options are available. Men should initiate sexual activities. Not true. Everyone can initiate sexual activities. It doesn't just need to be the man. When you look at your own values and beliefs, it's important to recognize if they are influenced by these myths. If they are, and when you start to see changes with sexual health or function, that's when we run into problems, as it can provide a barrier to exploring new opportunities.
Next, we'll talk about intimacy. Intimacy is an umbrella term for that affectionate or loving personal relationship with another person. It's that closeness that you feel with someone. There are multiple dimensions that make up intimacy, and it is powerful to share intimacy with another person. We had once done a workshop where we had identified over 40 different types of intimacies a couple could share. Today, we're going to focus on 4 primary intimacies. Number 1 is intellectual intimacy. This is the rich meeting of the minds. They are your interests, your thoughts, ideas, and connection on values. Next, we have experiential intimacy. This is the closeness in activities, what you do together that you enjoy. Next, we have sexual intimacy, and this is the practices of sexual relationship with a partner. And last but not least, we have emotional intimacy, which is how you support each other, being vulnerable together, and feelings of closeness and trust. For some, there may be spiritual intimacy as well. There are many ways of being intimate with one's partner, and it's important to communicate what dimensions of intimacy are important to you and how to maintain that closeness throughout your relationship. You'll notice that each bubble in the picture is equally balanced and they're all the same size. In reality, you may find that some of these bubbles are different sizes depending on what is important or relevant in your life. For example, the emotional bubble may be more important in your relationship than the sexual bubble, and that's okay. You get to decide how to share intimacy with someone. Now let's explore what is normal sexual function. We'll take a look at the sexual response cycle. Most people start with having sexual desire and arousal, where you become sexually excited. Then an erection may occur, although it is not necessarily needed. After the erection, you may arrive at orgasm or climax, which is usually coupled with ejaculation, a release of fluid. We'd like to point out here that orgasm and ejaculation are different processes. Orgasm is the pleasurable sensation typically achieved after sexual stimulation, whereas ejaculation involves movement of the semen out of the penis. The prostate and seminal vesicles create 90% of the fluid found in semen. When the prostate and seminal vesicles are removed or become damaged, then the amount of fluid will be impacted. Lastly, you enter the resolution and refractory phase, where the penis becomes flaccid or softened, and another orgasm or erection is not possible for a period of time. The recovery phase increases with age. There are many factors that can affect each of these processes, and each process can directly impact another. Here are some factors that can affect the sexual response cycle. Lifestyle factors can include diet, exercise, excessive alcohol or drug use, and sleep patterns. Psychological or emotional factors can include anxiety, depression, or stress. Medication and medical conditions can include diabetes, chronic pain, or high blood pressure. As well, some people don't realize that medications such as hormones or antidepressants can impact your sexual response cycle, especially the arousal part. If this is concerning, talk to your doctor as there may be alternative medications. Sexual dysfunction can include any concerns or disruptions to your baseline sexual function. Age is a factor as well, as many people do experience changes to their sexual function with age. And of course, cancer treatment can have a big impact. For example, injury to the cavernosal nerves, which impact erectile function.
So now let's take some time to talk about how erections work. Erections occur from thinking sexual thoughts, from sexual touch, or inner sleep. All forms of erections require a signal to be transmitted from the spinal cord to the penis via an important nerve called the cavernosal nerve. The nerve sends signals to your blood vessels telling them to relax and let more blood into the penis. You can see in the cross-section picture of the penis two structures that look like tubes, which are erectile bodies known as corpus cavernosum. Inside the erectile bodies, there are tiny spaces, kind of like a sponge or Swiss cheese. When the smooth muscle in these tiny cavities relaxes, the cavities expand and allow blood to flow in, forming an erection. Another important note, normally men will have what we call nocturnal erections, which involves having up to 3 to 6 spontaneous erections per night. Most are unaware of this unless you wake up and notice the morning wood. It's the penis's natural way of working out, providing oxygen-rich blood to the tissues for it to stay healthy. If you're not having any sexual erections or noticing those nocturnal erections, then you may need to engage in penile rehabilitation or optimization to keep the blood flowing. We'll talk more about how to keep your penis healthy later on in this presentation. Prostate cancer treatment or bladder cancer treatment can cause erectile dysfunction. This may occur in 3 processes. The nerves that help cause erections can become injured. The muscle in your penis can become fibrotic or less healthy over time. And the arteries which bring blood into the penis become damaged, which stops the penis from receiving adequate blood flow. Let's look at these in more detail. First, we'll talk about nerve injury. The nerves that are important for creating erections are shown here in yellow. They are called cavernosal nerves. They start in the spinal cord and run down the back of the bladder, wrapping around the prostate and into the penis. The cavernosal nerves are very close to the prostate, essentially a cell layer away, which is why any treatment for prostate or bladder cancer can cause damage to these nerves. Let's take a closer look at the various cancer treatments and how they can affect the nerves. Surgery. While the primary goal is to remove the cancer, if the surgeon is able to, they will try to spare the cavernous nerves. This is called a nerve-sparing surgery. It is not always possible to spare the nerves, though, depending on the characteristics of the cancer. You can also have issues with erectile dysfunction even if the nerves are spared. The nerves are very sensitive and can enter into a shock phase called neuropraxia. In that shock phase, they aren't working anymore, and it can take up to 2 to 4 years for the nerves to heal and come out of that shock phase. Your body will have the final say of how it's going to recover. Next, we're going to talk about radiation. Radiation eliminates cancer cells by directly destroying the cells or by damaging their DNA. For external beam radiation, the red area is the prostate receiving the highest dose of radiation. The green area, which includes the cavernosal nerves, receives a smaller dose of radiation, about 40% of the dose. Other areas in the pelvis will be affected, including the bladder and the rectum, which is why many patients have other side effects while receiving radiation therapy. Brachytherapy, this involves the placement of radioactive seeds directly into or close to the tumor using needles, wires, or catheters to destroy cancer cells. The region surrounding this may be affected, including the nerves.
Next, we'll talk about muscle fibrosis. Prostate cancer treatment can cause the muscle within the penis to become more fibrous and less healthy over time. Around the penile muscle, there is this sheath of tissue called the tunica. You can think of this as saran wrap. And normally, when the penis fills with blood, the muscle expands and closes off the blood vessels against the tunica. This keeps the blood in the penis to maintain an erection. With the tissue becoming more fibrotic, it won't have that ability to expand against the tunica, which will prevent the blood from staying in the penis, and this is what we call venous leak. So imagine you're going for a bike ride and need to fill air into your bicycle tire. If the valve isn't sealed properly, no matter how much air you pump into the tire, the air will not stay inside, and the tire will be soft. So it's the same idea with venous leak. You might have good blood flow going into the penis, yet if unable to seal off the veins, the blood will return into the body, causing a flaccid or soft penis. Lastly, we'll talk about compromised arterial inflow. To form a rigid erection, you need to have good blood flow going into your penis. Prostate cancer treatment can cause the blood vessels inside the penis to become damaged. This can limit the blood flow going into the penis, causing erectile dysfunction. If this occurs, you may require treatment to ensure your penis gets enough blood to stay healthy. Compromised arterial inflow may be reversible depending on the treatment and damage. Now we will review the changes that can occur after prostate cancer treatment. Some patients will start with something called active surveillance or watchful waiting, where the doctor will decide to monitor the cancer without treatment. This is for men with intermediate or low-risk prostate cancer. There aren't usually too many side effects as there is no treatment, so if there are side effects, it would usually be from anxiety or other psychological factors. Sexual drive may decrease due to stress or anxiety. Erectile dysfunction may occur and potential changes to orgasm due to stress or anxiety. There are no changes to ejaculation, there's no penile shortening, no urinary issues, and no bowel issues or other changes.
So for prostatectomy, the onset is immediate as the nerves will be affected either by removing them or from shock. With sexual drive, it's not directly affected unless you are stressed. Erectile dysfunction can be immediate. Most experience it at least for 6 months, but repair can, however, take up to 2 to 4 years. Orgasm. 40% of men will find the orgasm to be the same post-surgery. 40% will say it is different, and 20% will say it's better. In fact, some men have learned the secrets of women and become multi-orgasmic. Approximately 50% have pain with orgasm, which is usually temporary and can be due to muscle spasm. The pain generally decreases over the first year. With ejaculation, there will be no ejaculate as the prostate gland and seminal vesicles have been removed. Men report different experiences with dry orgasms. Some describe a more intense orgasm, while others feel orgasm is not as pleasurable. The Copper's glands are not affected in surgery, therefore you may notice pre-cum or pre-ejaculatory fluid, which is still present. Penile shortening, many men will report penile shortening and shrinkage following surgery. There are a number of factors that may contribute to this, including scar tissue formation, reconnecting of urethra to the bladder, and damage or interruption to the blood supply of the nerves. The reason for penile shortening and shrinkage are not fully understood, but the length can be restored usually by 1.5 to 2 years. With urinary, there may be a thinner fluid present with orgasm after surgery. This is known as climacturia, or the release of urine at climax or orgasm. Urine is considered sterile. It is clean. And as long as you don't have an infection, it won't be harmful to your partner if urine gets in or on them. Climacturia usually improves in the first 6 months after treatment. If no improvement or you have any questions or concerns, come to our Module 5 presentation called Pelvic Floor Physiotherapy for Bladder and Bowel Concerns. And there's no concerns with bowel issues or others. Next is radiation therapy. This includes external beam radiation, which uses linear accelerator and X-rays to destroy the cancer cells, and brachytherapy, which is inserting small radioactive seeds into the prostate. Onset for external beam radiation, there is a minimal erectile changes immediately post-treatment, but for brachytherapy, there can be immediate changes due to irritation from the procedure. With sexual drive, not usually decreased unless you are on androgen deprivation therapy. For erectile dysfunction for external beam radiation, erectile changes generally are noted about 1 to 3 years post-treatment, and for brachytherapy, after the initial decline, there can be some improvement in function over the next 6 to 12 months, and then some decline after. Orgasm, you may have some short-term pain with orgasm or difficulty reaching orgasm, and ejaculation, sometimes it's decreased, or there might be a dry ejaculation, or there could be blood noted in the ejaculation if you've had brachytherapy. Penile shortening is possible, but it's more rare. With urinary issues, the bladder is in the same field as radiation, so it may become irritated and cause issues such as increased frequency, difficulty urinary, blood in urine. With brachytherapy, urinary symptoms are common about 7 days post-implant. Increased urgency, nocturia, which is voiding overnight, and dysuria with pain with voiding. These symptoms can persist for several months and gradually resolve. 5 to 10% of men will require catheterization from obstruction. For the bowel, the prostate and rectum are very close, so they can be bowel side effects such as diarrhea or inflammation of the rectum or anus. And other common changes for radiation, there can be skin irritation, burns, and for brachytherapy, there can be pain at the treatment site.
ADT, or hormone treatment, reduces testosterone, which is the fuel source for the prostate cancer to grow. Testosterone is very involved in sexual function and can impact a lot of different areas. The onset is typically gradual. Sexual drive is decreased in most men. Erectile dysfunction usually occurs gradually and is more noted as the testosterone levels decrease. Orgasm can be decreased in intensity. Ejaculation can be decreased in volume. And penile shortening is very common with hormone treatment. Some men will report testicular shrinkage as well. Men have reported once they stop ADT, the anatomy will return to its normal state. For urinary and bowel issues, there usually are not any concerns in these areas. However, there are many other common changes, such as weight gain, breast swelling, fatigue, and hot flashes. If you are on ADT or considering hormonal treatment, we highly recommend you attend our education session on androgen deprivation therapy, where we spend about an hour going over all the possible side effects and how to manage them. Feel free to contact our program coordinator if you're interested in attending. The idea is that if you have good pre-treatment erectile function, the better chance you will have good erectile function post-treatment. Age is an important factor as erectile dysfunction is a normal aging process. Younger men may have slightly less impact or recover quicker. It's important to consider your pre-existing medical conditions and the type of cancer treatment you've had. Remember, no matter what factors are involved, it is your body that has the final say in how it will recover. In the meantime, it is important to be proactive in supporting your recovery. It's important to know that despite many challenges and barriers to overcome, you can still have a good sex life after prostate cancer treatment. For many couples, they have a pattern of being sexual. There's nothing wrong with having a pattern. It's something familiar that leads to a pleasurable experience. Prostate or bladder cancer causes a change in the pattern of how you make love. We like to think of this as an opportunity to redesign your sexual life. Think of new ways of being sexual that were not thought of before because you had a pattern. So how do we move forward or go about managing this? Let's take a look at some approaches for managing sexual consequences of prostate cancer treatment. You can work with us, your sexual health clinicians, and schedule a one-on-one appointment. If you have a partner, we encourage them to attend as well. We'll talk more about communication, adaptation, and the therapies involved for improving erectile function in the next few slides.
The most important way to improve your connection and sexual functioning is through communication. By maintaining an open dialogue, you can ensure that each of you are satisfied with your sexual relationship together and on the same page. So you might be asking, why should we talk more? Well, it's the best way to enhance your sexual satisfaction after having treatment. Sharing your thoughts and feelings can help you both process any changes. We like to say prostate or bladder cancer is a couple's disease, as a cancer or its treatment can affect the partner just as much as a person with cancer. This is why it's important to ask your partner how you're feeling. We often think that we know someone so well that we can read their mind, yet this isn't true. And research has proven this. It is important not to assume your partner feels a certain way. So how do we communicate better? Well, think about what is important to you and your partner. Discuss both your thoughts and pay attention to your partner's responses and acknowledge their feelings. If you don't feel comfortable talking about it out loud, you can write a letter or make some notes. You can always see a counselor or a sex therapist trained to open up the conversation and make it easier to talk about. Here's that intimacy diagram that we saw earlier in the presentation to remind you that there are many ways to connect with your partner. It may feel natural to put all the focus on sexual type of intimacy, especially if erections are not working post-treatment. Yet it is important to look at all the dimensions of intimacy. There are many ways to enjoy being close with your partner. Many couples have shared with us that their different dimensions of intimacy have actually improved as they go through their cancer experience. So most of this is focused on partnered relationships. Being sexually active and feeling attractive is just as important if you're single. The same treatments and resources are available for single men, whether you want to be able to masturbate, have sex, or start a new relationship. All this information applies, and we highly encourage single men to come to our clinic. If you are starting a new relationship, we know it can be challenging to share your cancer experience. What we find that is important is just being honest and keeping things simple. If you are starting a new relationship, we know it can be challenging to share your cancer experience. we find that being honest and keeping it simple is important. Prostate cancer can cause changes in your sexual life that require adaptation. This process can be complex and warrants the need to apply the principles of acceptance, flexibility, patience, and persistence. Acceptance is understanding the sexual consequences of treatment. Why have they happened, but more importantly, how you're coping with them. It can also include grieving loss, moving forward with new ways of being sexual, as well as redefining one's sexual self-view. Flexibility is having an open mind, being able to reflect back on your beliefs, your values, and behaviors, and make adjustments as necessary. Patience and persistence are also important since it takes a long time for your body to heal and to master new ways of being sexual. The sexual adaptation process may include sexual and penile rehabilitation, or what we like to call optimization.
Sexual optimization begins with an awareness for the potential for sexual difficulties following any disruption in health. When you start sexual optimization, you can focus on gaining knowledge about sexuality and how to cope with difficulties, communicating with a partner, how to manage feelings of sexual inadequacy and masculinity, understanding how societal myths affect your sexuality, adjusting values and beliefs to enhance your sexuality, and discovering new ways of supporting your sexual health and goals. Penile optimization focuses on the health of the erectile tissue. It is the idea that if you can continue to stimulate the muscle with or without a partner, later erectile function can be improved. Remember when we discussed those nocturnal erections, the penis's natural way of working out? When you don't have that natural workout, you may need to do this yourself to keep the penis healthy. Tissue can become fibrotic over time if it's not used. Just like any muscle in the body, if we don't use our muscles, our body can become deconditioned. It's the same idea with the penis. It needs to be working out to stay healthy. There are various ways of engaging in penile optimization. There's penile massage, oral medications, injections, and vacuum therapy. Your treatment and recovery will determine when you can start these interventions. Talk to your doctor about when it is safe to do so. We recommend doing penile optimization for a minimum of 2 to 3 times per week, and continuing to do this until spontaneous erections come back. Remember, this can take time. With surgery, for example, it can be several years before the cavernosal nerves heal. Let's talk about some of the erectile dysfunction treatment. The oral therapies, or pills, inhibit the enzyme called phosphodiesterase 5, or PDE5 for short. This enzyme is present in the cells lining the smooth muscle tissue in the penis. When we inhibit the enzyme, it causes the smooth muscle to relax more and allows blood into the penis to form an erection. The first thing that men will usually try are the oral therapies, as they are considered one of the easier and least invasive therapies. All of these pills work similarly as they belong to the same family of medication. However, some men respond better to one than another, or you may have side effects with one and not another. So it's good to try them all at different times to see which one is the most effective for you. Something to be aware of is if you use a nitro spray, take blood pressure medication, or have low blood pressure, the PDE5 inhibitors may not be appropriate for you. Always talk to a doctor before taking these medications. Another thing to consider is your nerve function and the level of testosterone. If your nerves are still healing or they've been removed, the pills might not be effective. If you are on androgen deprivation therapy, the PDE5 inhibitors may not be effective as they rely on testosterone to work. That being said, we have had men on ADT or who have had no nerves spared in their surgery that have still responded to the pills, so it doesn't hurt to try. Some of the PDE5 inhibitors are short-acting and some of them are long-acting. The short-acting ones are Viagra, Levitra, and Staxin. They stay in the body for up to 8 hours. The long-acting one is Cialis, which can stay in the body for up to 36 hours. It's really important to know that you need to have good sexual thoughts and stimulation after taking the pills. You can't just take a pill and be reading the newspaper waiting for something to happen. Potential side effects to be aware of are indigestion, facial flushing, nasal congestion, headache, blurry vision with Viagra, muscle cramping with Cialis, and hearing changes with Cialis. Viagra and Levitra are significantly affected by fatty foods and alcohol. Take these on an empty stomach or wait at least 2 hours after completing a meal. You can ask your urologist or family doctor for samples, as the pills can be quite expensive. Some extended benefits may offer partial coverage. Next up, we have MUSE. MUSE stands for Medicated Urethral System for Erections. It is a tiny pellet or suppository about the size of a grain of rice, which is administered into the urethra, which is the same area as where a catheter would go, using an applicator. It looks as though it might be uncomfortable, but it is actually quite well tolerated and it can give a good quality erection within about 10 to 15 minutes. MUSE is not commonly used in Canada as it's expensive, about $40 to $70 per dose or more, if not covered by insurance, and it only works in about 40% of men. Also, MUSE might not be appropriate for all patients. For example, if you have any urinary leakage, the medication will not be absorbed properly. A side effect to be aware of is that the medication can cause irritation to your urethra and your partner's vagina or rectum if you are having penetrative sexual activity.
So penile injections are the most effective erectile dysfunction treatment, 90% effective and one of the most affordable therapies. Penile injections are not reliant on nerve function or testosterone to be effective. It is a local response where you inject a small amount of medication into one side of the penis, which causes the smooth muscle in the penis to relax, causing blood to flow in and form an erection. The erection will develop within 5 to 20 minutes, lasting 30 to 60 minutes. A lot of men are hesitant to try penile injections as they are afraid it will be painful, or many people do not like needles. I will say it is a very small needle and most men don't even feel it. The most challenging part of the injection is psychological aspect and being comfortable with the technique. In our clinic, we do one-to-one teaching. We discuss how the medication works, possible side effects and how they are managed, how to draw up the medication, different holding techniques, how to inject, and dosing of the medication. Possible risks include priapism, which is a prolonged erection, or scarring of the penile tissue. There is very small risk for both of these. The vacuum erection device, or VED. You may have seen some of these in adult love shops or online. We recommend using a medical grade VED to prevent any damage to erectile tissue and to ensure it is effective. It is 80 to 90% effective when used correctly. If you purchase a VED, we recommend using it daily for 14 days. This will allow you to master using the device and help to recondition the penile tissue. The VED can be used for two purposes. It can be used for penile optimization, which is exercising the penis, and you can use it for sexual activities, whether that is self-stimulation or with a partner. You can also use the VED with PD5 inhibitors, MUSE, or penile injections. So how it works, the negative pressure generated by the device pulls blood from the veins and arteries into the penis to create the erection. Once you remove the device, the erection will fade. If you want to maintain the erection, you will need to use a tension band. You can only wear the tension band for 30 minutes at once. Recommendation is do not roll over and fall asleep with this on. So some tips, you need to have a good seal, which can be accomplished by using a water-based lubricant and trimming back the pubic hair. There are a few considerations when using the VED. The erection can look like a dusky blue color and it may be a little bit cool to touch when formed. This is from drawing the blood from the veins, which doesn't normally happen with natural erections. It is not harmful, yet it can be distressing if you're not informed. You can use a lubricant and warm the erection in your hands prior to intercourse if this is bothersome for you. When using the VED and tension band for sexual activities, whether that is for self-stimulation or being with a partner, you may notice a hinge effect. This is because the blood is only maintained until the base of the penis. It does not go deeper into the pelvis as a natural erection would. So I recommend just using a hand to guide the penis into the vagina, anus, mouth, or toy before engaging in any activity. You may have to experiment with different positions with your partner. Last but not least is the penile implant. This is a permanent procedure, so once you have the implant, you can't decide to go back to using the pills, injections, or the VED. The benefits of the penile implant is that it takes 10 seconds to form a 100% rigid erection. 90% of men say that they are satisfied with their penile implant. It is a 1 to 1.5 hour surgical procedure and covered by the Canadian health system, so it's 100% free of charge. There are different models of implants. The one pictured here is a 3-piece implant. There is a pump in the scrotal sac, a fluid reservoir in the pelvis, and 2 cylinders which replace the erectile bodies in the penis. Once healed, your doctor will show you how to cycle it. Doctors will usually wait until about 2 years post-treatment before discussing the implant to ensure you have achieved the best possible recovery for natural erections. One thing to consider, it does not extend the length of the penis at all. If you lift the penis while it's in the flaccid or non-erect state away from your body, that's about the size it would be when using the implant.
So how do you begin? Remember that nothing is a quick fix. It takes time and practice. You can begin by talking to your partner. This can help you deal with the changes. Discuss ways of enhancing intimacy without penetration. There are many ways. Communicate with your partner about what you'd like to see in your sexual relationship together and what feels good for both of you. Request an appointment with our sexual health clinic and our counselor, that's an option. And our hope is that this information is helpful and empowers you as you journey through the sexual adaptation process. And in order to supplement the information you've received today, if you go to our website, you can find videos which provide further information about these points. We recognize that talking about cancer can be overwhelming. Even watching an education session such as this, you're exposed to a lot of information, and this can create some anxiety or uncertainty. These feelings are normal. Our counselor can help you navigate some of these emotions, so please feel free to request an appointment if needed.
Both Megan and I are looking forward to supporting you with your sexual adaptation process. Thank you for taking the time to view this video today. Thank you.